Well, May is Mental Health Awareness Month, and the Peace Center for Reconciliation is doing good mental health, maintaining your mental health in a world gone mad. And joining us today, one of the panelists, Reverend Dr. Tom Holmes, retired counselor, pastor of Carroll United Methodist Church, and he's on the panel. And then, of course, John Foster, he is with the Peace Center. So thanks for coming today, both of you.
Thank you. Thank you.
Okay, so John, this does fit in well with, the Center for Peace and Reconciliation. You got to have good mental health. So what was the reasoning behind this topic?
We've always, for the past year, we've thought about a program such as this because we've been asked by different individuals perhaps to have a program featuring mental health, and not only with the youth but also adults, something that combines both the situations that the youth have to deal with today and also the adults. So it's a combination of the two.
All right, so the program's on May 28th at 7 o'clock at the center. And Dr. Tom, what kind of things will you bring up at this panel discussion, you think?
When you look at the subject of mental health, it's like asking the question, solve the national budget, or correct the debt. It's like, where do we start? Because naturally there's two sides of this. One is the nature side, which is there are some people who are prone to, biologically speaking, certain anxiety, depressive system, all kinds of mental health issues. And the other side is the nurture side. And what we know in our modern life is that certain things we do in our society just do not help in our mental health.
Right.
And just a typical example, a simple one, and again, solve the problem. How do you do that? It is to recognize is that the rise of mental health is increasing, poor mental health is increasing among our children. And seems to be a direct correlation between that and the rise of the use of electronic devices.
Sure enough, yeah.
And so there's lots of reasons for that. We could go into that. We're not going to. But really what we want to focus on is maintaining good mental health in the midst of this myriad of things that are very unhealthy.
Right, yeah. Well, it seems like every day you could get slammed with something that's unhealthy with, mental health on social media anywhere,
Well, yes, and you can't even have a good conversation about anything without getting someone riled up or out of joint.
I think things are getting better. At least we can talk about mental health. I mean,
well,
at least you can have a panel, and this can be a discussion, where in the past maybe not.
That is right. Years ago, it's a shameful thing to talk about mental health, but now it's something that is acceptable. What we can't talk about is the issues.
Right, yeah, exactly,
So those are the issues, of the things that trip us up and make us, so if someone says something I don't agree with, we get all bent out of shape.
Right, yeah, we need to learn to control some of that.
Poor mental health.
Yeah, exactly. Well, it is a panel discussion, and John, this format, it'll probably work out good, and you want to fill the house, at the center for people to talk about this, right?
And at the end, toward the end, we will have open discussion, questions that people might have. So it's not only for the panel to discuss what they interpret to be good mental health versus poor, but also availability for question and answers.
Right, yeah, exactly. So is it mainly for adults, you would think, or, bring the teens and bring some youth to this?
It's welcome to all. Welcome to all. It's an open door policy.
Open door policy, all right. So it is Wednesday, May 28th at 7 o'clock, of course, at the Center for Peace and Reconciliation on South Pierce Street. So it sounds like it's going to be a great event, and we're going to talk about mental health. And Dr. Tom, thanks for coming today. Good to see you. And
Good
John,
to be here.
thanks for coming too.
You're welcome.
All right, don't go away. First Edition continues in a moment.